2 minutes.
Thank you, Lascan Corla. And first of all, Lascan Corla, I want to echo the comments that you made earlier. I raised this issue 3 weeks ago in parliamentary questions that I'm still waiting a reply to. I've raised it as a topical issue on 5 occasions over that period, and none of the 3 ministers thought it worth the while to come in here and address this crisis that we have in the acute psychiatric unit of Roscommon County Hospital, which requires urgent and immediate action from the Department of Health. The crisis has its origin, I believe, in a decision made last August. At that time, I expressed my serious concerns to senior management. I expressed my reservations last April. On both occasions, I was assured that there were adequate provisions in place to cater for all patients and to ensure the safety of patients, the staff and the community at large. Yet, in spite of these assurances, in the last number of weeks, 2 families have gone public, namely the family of a 38-year-old mother who died following a tragic incident, have called for a public inquiry into the circumstances surrounding her death on foot of an incident in the acute psychiatric unit. And the family of a second patient who was seriously assaulted by a male patient and was subsequently allowed back in close proximity to the innocent victim due to the unavailability of appropriate alternative accommodation. During this same period, 2 female nursing staff have also been seriously assaulted. To compound this, in recent months, An Garda Síochána have been called on a number of occasions to attend to the unit and support staff there. I wish to state categorically that I am deeply concerned by the range of reports that I have received regarding the capacity of the facility to cater for the existing demands and ongoing needs of the community which it serves. There is no doubt from senior management right down that the current staffing levels in the psychiatric services in County Roscommon are grossly inadequate to deal with the existing caseload of the acute unit. As a direct result, management has redeployed staff from the community and day services to try to assist the operation of the acute unit. This is leaving service users without day services and without vital community supports, which is even putting further pressure on the acute psychiatric services locally. 2 immediate steps now are urgently required. Firstly, additional staffing have to be allocated to the psychiatric service in County Roscommon in light of the fact that there has been a disproportionate loss of staff as a result of retirements. And secondly, long-term involuntary patients should not be accommodated in an acute psychiatric unit, and steps must be taken to transfer such patients to more appropriate facilities as a matter of urgency. Thank you.
Luke Flanagan, 2 minutes.
For years, it has been correctly said that governments don't give a damn about people with mental illness. And we had a private members' motion here, the technical group on it, and we outlined our concerns and what we'd like to see done about 18 or 19 months ago. And we didn't bring it to a vote because we didn't want to turn it into a political football. It's way too serious for that. And we said we trust the Minister to do her job. Now, yesterday at the Oversight Committee, Minister Kathleen Lynch was there talking about suicide awareness and what we'd do about a suicide strategy, etc. And she said that what needed to be there was, and I'll quote, "When people reach out, there should be help. The environment should be enabling and not disabling. And all we can do is ensure people will know what they have to do or what they need to do if they get in trouble." Well, it was outlined to the Minister yesterday about what was going on there. Now, I imagine she's well aware of it. And I was told I'd be getting some answers. Now, no more than Deputy Naughton, this week I put down topical issues on Tuesday and Wednesday, and it was refused. Obviously, it isn't important enough that our psychiatric hospital is in dire trouble. And today it is selected. And the Minister, who cares, or one of them surely should care, doesn't even bother to turn up. It is sick and twisted, what's after happening here today. There's a public meeting in Roscommon this evening to discuss what we're going to do. And the message we have to bring back, myself and Deputy Naughton, is that really no one seems to give a damn And we hear this rubbish about, oh, if you had a broken leg, you know, someone would take care of you. I agree, yeah, they should. And a mental health problem should be treated equally as importantly. But it's quite clear that is not happening. And it really is not good enough that you be brought in here. With respect to you, you're an expert on other issues, but on this one, you know nothing about it, and it's an insult.
Gurmagada Hakta August Tara, 4 minutes.
Well, firstly, Laskin Corner, I want to apologise on the fact that Minister Lynch isn't able to be here today. She's in Brussels. And as both Deputy Flanagan and Deputy Naughton both know, the selection of topical issues is a matter exclusively for the Ceann Comhairle and his office. And in a circumstance where she's not here, she's not here. And she regrets very much that she's not here, because she would have more than happy to take this debate and respond, I think. Well, she doesn't select the topical issues, Deputy. She doesn't select the topical issues, and you know that. So in fairness to her, she's not in the country today. She's representing the government in Brussels today. But I would, on her behalf, obviously like to thank both deputies for raising this issue, and I do understand the sensitivity of this in County Roscommon. Addressing the generally accepted historical deficiencies covering both capital and non-capital aspects of our mental health services remains a priority for, I would hope, every government, or any government that's in the state. This has been reflected by carrying through on our programme for government commitments, with some 70 million provided this year and last year for a range of new posts and other specific initiatives relating to mental health and suicide prevention. Notwithstanding progress on addressing the overall financial pressure still facing the country and the demands being placed on all areas of our care system, the mental health budget increased this year from 711 million in 2012 to 733 million this year, 2013. The HSE service plan for this year indicates that Galway Roscommon local health office will receive in the region of 69 million euro for mental health services in this year, 2013. The deputies will appreciate that the HSE has statutory and operational responsibility for the planning and delivery of service at local level, including in County Roscommon. Both community and inpatient services are provided in Roscommon and are deemed to be the one entity in the context of the Galway Roscommon local health office area. Services include, for example, outpatient clinics in various towns in County Roscommon, augmented by community mental health nurses visiting clients in their own homes. Notwithstanding the challenges presented by the need to reform our health services overall, including our mental health services, the objectives of change will be undertaken while maintaining safety and quality throughout all our health services. In relation to the acute psychiatric unit in Roscommon, the HSE has indicated that this unit has regular high activity levels due to the needs of clients and the nature and their complexities of their illnesses. Unfortunately, there has been recent instances at the inpatient unit, but these were not due to staffing shortages. At weekends, the full complement of nursing staff and senior managers are on duty, and a consultant psychiatrist and medical staff are available on call throughout the weekend. Patients who require treatment are assessed and evaluated by the nursing and medical team. This is the normal practice. There have been over recent times staff requirements and resignations that Deputy Naughton referred to, not all of whom can be replaced owing to the moratorium on recruitment. As a result, staffing levels are reviewed on a daily basis and members of staff can be relocated according to the needs of the service. There have also been occasions when staff is required urgently elsewhere, where redeployment occurs on that basis. In the context of the issue raised, the HSE is seeking to redeploy nurse management in Galway Roscommon to provide enhanced management and leadership as required for mental health provision. The House can be assured that this government is very focused on developing mental health services, not alone in County Galway and County Roscommon, but nationwide. In line with our vision for change, the Department of Health will continue to liaise closely with the HSE on the specific issues that have been raised.
Thank you. Deputies, you have 2 minutes, 1 minute each, I presume.
Yeah. I have to say, Minister, I am extremely disappointed with the response that I've received from you, and except Minister Lynch is away, but there are 2 other ministers in that department, and this is a serious issue. The redeployment of management isn't what the issue is here. We need nursing staff within that acute psychiatric unit, and we need that nursing staff in place now, and that is coming from everyone that is dealing with the service. Secondly, Minister, we need to ensure that the long-term involuntary patients that are in the acute unit are put into more appropriate settings. What is going on at the moment in the acute unit in Roscommon is akin to an older person requiring a nursing home bed, taking up an intensive care bed in one of the tertiary treatment hospitals in this country. That's what's going on at the moment. It's unacceptable. It cannot continue. And we need immediate action from one of the three ministers now, today, in relation to this.
Thank you. Deputy Lieutenant Flanagan, 1 minute.
Yeah, I hear this mention of vision for change, and I love the idea of vision for change and the whole concept that people could be treated out in the community and that they wouldn't be stuck in big units unnecessarily. But that's not happening. And there's no point trying to cod people into thinking that is happening. In fact, the opposite is happening. In order to facilitate the shortage of staff in the hospital, they're actually taking it out of community care, which doesn't make an awful lot of sense. And people who could have dealt with their issues through the community area where these people were working, that is less available to them now, and they're less likely to use it. And as a result, they're more likely to get more mentally ill, and they're more likely to need the unit in Roscommon. So, you can say it all you want, but it doesn't change the reality. You're not doing this vision for change. You are not being fair to those people in Roscommon in the psychiatric hospital. People at their most vulnerable. And I have families contacting me telling me that they have mentally ill members of their family, but they're terrified to send them in that direction because they actually feel they'd be safer at home, unsafe and all as that is. So, instead of turning up at Pieta House runs at 4 o'clock in the morning, like a lot of government TDs do, and I did myself, and so did Deputy Naughton, I think we want to get a little bit more serious about this, because you can all cry about it when it's too late, but how about you do something about it now before it is too late? It's not on. We are going back to the equivalent of bedlam and lunatic asylums with your policies, and that's not on. I thought we'd moved on. We haven't.
2 minutes.
Last Cancora, a number of serious issues have been raised in the context of this debate this afternoon, especially the remarks by Deputy Naughton. One is the question of the staffing component in the psychiatric unit in County Roscommon, and I'll direct the HSE to respond to him and to Deputy Flanagan on that issue. The official position is such that the complement is there, despite the fact, as he rightly points out, there has been a significant increase, as I understand, in the number of people who've left the service. But they're trying to deal with relocating people who would have some knowledge and expertise in this area. That's the first point. The secondly, and I would ask them to directly reply to you on this issue, there is an issue of the appropriateness of having long-term patients within that setting. That's a problem we have right the way across the system, as he as well knows. But I will ask them to reply to you on that issue as well, because in all of this, the appropriate setting, particularly in a psychiatric case or a psychiatric unit, as he has described, is important. That we minimise the difficulty for people and have an environment where people and their families can have confidence. Finally, can I say this, despite the difficulties that we all face on budgets, there, as I understand it, from the information available to me, that at present there are 21 new posts advertised, and we're now in the process of recruiting those additional people. And these are people who have an expertise in the psychiatry of later life, suicide prevention, community mental health, self-harm, and liaison psychiatry. Now, it would seem to me they're the kind of professionals and experts that we do need to have part and parcel of the service. That's happening. The reason why the additional 21 people are now being advertised for recruitment is because of the additional funding that, in fairness to Minister Lynch, she was able to obtain in this area over the course of the last 12 months. in a circumstance where budgets are being cut, this area is one of the few areas where budgets have been extended. So by extending the vote, by extending the budget, doing things differently, relocating people, trying to manage the service, I hope we can get to a better place in a reasonable and transparent way. But there are issues which have to be addressed, and I will instruct the HSE to reply directly to the deputies.
Thank you. That concludes the topical questions. Before we move on to